Hi and welcome to our telehealth video information series. My name is Garvin and this video is on Lexotan. So what is Lexotan used for? Lexotan contains the active ingredient bromazepam, and Lexotan belongs to a group of medicines called benzodiazepines, which are thought to work by their action on brain chemicals. Lexotan is used for anxiety, tension or agitation. In general, benzodiazepines such as Lexotan should be taken for short periods only, for example 2 to 4 weeks. Continuous long-term use is not recommended unless advised by a doctor. This medicine may be addictive. So, how does it work? Bromazepam is a benzodiazepine with anxiolytic action. At low doses, Lexotan selectively reduces tension and anxiety. At high doses, sedative and muscle relaxant properties appear. So, as I said, the active ingredient is a chemical called bromazepam, and Lexotan tablets are gluten-free. So, for dosage advice, how do you use Lexotan? First of all, do not use Lexotan if you have had an allergic reaction to Lexotan or other benzodiazepines. Some of the symptoms of an allergic reaction would include shortness of breath, wheezing, difficulty breathing, and swelling of the face, tongue, and rashes and itchy skin. Also, do not take Lexotan if you have severe and chronic lung disease, you have severe liver disease, or you suffer from sleep apnea, or you have a muscle weakness known as myasthenia gravis. Do not give Lexotan to children. The safety and effectiveness of Lexotan in children has not been established. And if you're not sure, you should talk about the Lexotan with your doctor. Lexotan is not recommended for use in pregnant women. Your doctor will discuss the risks and benefits of using Lexotan if you are pregnant or plan to become pregnant. And Lexotan passes into breast milk, and therefore is possible that the breastfed baby may be affected. Lexotan is not recommended whilst breastfeeding. So tell your doctor prescribing Lexotan if you have any other health problems, especially liver, kidney or lung disease, high or low blood pressure, or you suffer from depression, psychosis or schizophrenia, or if you suffer from fits or convulsions, which is epilepsy. You have a high pressure in your eye, which is glaucoma. And finally, alcohol can increase the effects of Lexotan, so be careful using alcohol with Lexotan. And some medicines may interact with Lexotan. These medicines would be other sleeping tablets, sedatives or tranquilizers, and other medicines for anxiety, and medicines used for certain mental and emotional conditions, and medicines for depression, such as fluvoxamine, and medicines to control epilepsy. And these medicines and others like them may be affected by Lexotan or may affect how well Lexotan works. You may need to use different amounts of your medicine, or you may need take different medicines completely, so your doctor will advise you on the best course of action. So how do you take Lexotan? The dose varies from person to person depending on age and the condition being treated. The usual dose is between 6 to 12 milligrams a day. So how do you take Lexotan? You swallow the tablet whole with a glass of water, and you take the tablet as directed by your doctor. It should be taken on an empty stomach 30 to 60 minutes before food. So how long to take Lexotan? Lexotan should be used for short periods only, for example 2 to 4 weeks. Continuous long-term use is not recommended unless advised by a doctor. The use of benzodiazepines may lead to dependence on the medicine. If you forget to take Lexotan, if it is almost time for your next dose, skip the dose you missed and take your next dose when it's due. Otherwise, take it as soon as you remember and then go back to taking it as you would normally. Do not take a double dose to make up for an earlier missed dose. So if you take too much Lexotan or overdose, or if you think you or anyone else may have taken too much Lexotan, immediately telephone your doctor or go to an A&E department at your nearest hospital, and do this even if there's no signs of discomfort or poisoning. If you take too much Lexotan, you may feel drowsy, confused, tired, dizzy, and have difficulty breathing, and could become unconscious. Do not drive or operate machinery until you know how Lexotan affects you. Lexotan may cause drowsiness or dizziness in some people and therefore may affect alertness. Make sure you know how you react to Lexotan before you drive a car, operate machinery, or do anything else that could be potentially dangerous if you are drowsy, dizzy, or not alert. Even if you take Lexotan at night, you may still be drowsy or dizzy in the morning. And do not suddenly stop taking Lexotan if you suffer from epilepsy. Suddenly stopping this medicine may make your epilepsy worse. And things to be careful of. Be careful if you are elderly, unwell, drinking alcohol, or taking other medicines. Some people may experience side effects such as drowsiness and confusion, which may increase the risk of a fall. Your doctor may suggest that you avoid alcohol or reduce the amount of alcohol you drink while taking Lexotan for this reason. And for storage, you keep your tablets in the blister pack until it is time to take them. Keep Lexotan in a cool, dry place where the temperature is below 30 degrees. And do not store the medicine or any other medicine in a bathroom or near a sink. So that brings this telehealth video to an end. If you have any questions, you can leave them here in the comments below, or contact me through our website mytelehealth.info, or call into us at Lynch's Pharmacy in Douglas and Cork, or ring on us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.